The college has existed for over 75 years now, and we have revamped ourselves over the past decade to position ourselves to be the leading peak body that provides professional development and support, networking, mentoring services to members who are in the health, aged, community, mental health sectors throughout Australia, New Zealand, Hong Kong and further afield.
Elderly people tend to have more health problems that might mean that you can't use some treatments. Psychological therapies might be harder to implement. If there's issues of cognitive decline occurring at the same time, that's another challenge. So I think it's really important to understand those things are there and to understand and recognise the importance of social connections and family. They're really important to keeping people away from loneliness and to have better engagement. Veterans are no different to the rest of the population. They too have health problems. They too really enjoy having good social connections and keeping in contact with their mates.
500,000 Australians missed out on seeing a medical specialist because of costs in 2019-2020. This is intolerable. We're supposed to have a universal health insurance, which means healthcare is accessible for all. Government needs to grasp a nettle and actually do something about making sure all of us can get access to care when we need it.
So ambulance services are facing a number of challenges, most importantly demand for services going up year on year. The fact that we have trouble getting into some emergency departments and hospitals because of their demand pressures are facing. The need to be adapting to a changing community. The community we're living in is not the same as it was, so we have to adapt to meet the needs of that community with different ways of thinking.
In some ways, Australia is ahead of the curve because we have built a base camp with our 164 headspace centres around Australia over the last 15 years. No other country's done that. So we're starting to address it. But the next bit we need to do is what we call the missing middle, the people who are too complex for primary care, headspace care, which is about 2/3 of the young people that come into a headspace need another level of care, a higher level of care. And these blueprints exist to what we need to do next. They exist in 6 locations already in Australia. We need to expand to 24 locations to back up our headspace system. So that's the most urgent thing we need to do.
Our March the 18th conference that was held in Melbourne is our first face-to-face meeting as a national group or an international group since 2020. So it's been great to come together. There's only so much you can do by Zoom or Teams in terms of the interaction, so the networking opportunities to renew acquaintances and develop those relationships which people can then help each other with as they go in their journey has been tremendous.